This is Everett, Washington, one of the first cities in the U.S. to see cases of COVID-19, and they're still recovering. A local hotel's coffee shop just opened for the first time in a year, and restaurants are still under half capacity. So we decided to take a look back and talk to the doctor that treated the first COVID-19 diagnosed patient here in the States.
We got a call from the CDC saying that we had the first patient in the U.S. with COVID and that they wanted us to admit him to our hospital.
Dr. George Diaz never could have imagined he would be the one to treat the first confirmed U.S. case of COVID-19.
It's like doing a fire drill. You never know when there's going to be a fire, but you drill enough. When it actually happens, you're ready for it, and you just move through the steps you have to do. So that's really what was in the forefront of our mind when we first got the first patient.
These photos from just about a year ago share a story of uncertainty, something many of us felt when we were just beginning to understand the virus and how it spreads.
We didn't know the disease at the beginning. We didn't know the symptoms associated with the disease. We used more PPE in our hospital during our first month of the pandemic than our entire 50 hospital health system used in a full year.
Providence Regional Medical Center Everett is still closed to visitors. The hospital has changed how it operates.
It caused essentially a complete change in the way we deliver health care.
Everyone has experienced the pandemic differently, and 2,000 miles away, healthcare workers have a different story.
We're standing in what is now a 53-bed open ward-style COVID ICU. We began to build this in March. We got it done in 2 weeks.
We added this unit later in the game.
Having an open ward, which is no longer really allowed in hospital code, we got special permission to do this.
Steve Edwards is the president of Cox Health here in Springfield, Missouri. This space was never meant to be a place for COVID patients to be laying just feet apart with these plastic dividers in between them. The roof remains unfinished, and before last year, it was used for storage. But Cox Health adapted as doctors saw cases rise around the world.
It went up on that sort of exponential curve, which we all feared.
This photo shows the room filled with patients and nurses. The picture is blurry because it was taken through the safety of a plastic bag. Each nurse's PPE was checked before entering the room.
It became incredibly personal to us. When I'd walk through this unit, I would see people I know that were struggling on maybe their last breath.
Fortunately, Steve has seen a decline since mid-January, and now this room is no longer needed. He hopes it stays that way.
It stayed open all the way until about 2 weeks ago. We probably saw more than 1,000 patients come through this unit. Probably had more than 300 patients in this unit eventually not leave the hospital. There was a single day we lost 7 lives. It was a moment that created a lot of joy in our organization when we shut this down.
In the past year, medical leaders have learned a lot about the virus, helping them shape their response through their experiences.
It's now on the forefront of our minds and will be with us for quite some time, I believe.
Rapid advancement in a crisis always occurs, and it's occurring now, and so I'm really grateful for that rapid advancement.
I'm Chloe Nordquist reporting.